I am Dr. Adil Riaz, working at Riaz Medical and Diagnostic Center as consultant radiologist, and we are here with the second episode of the basic ultrasound training course. In this episode, we are going to discuss how to hold the probe, how to note the correct side of the probe, what is the proper positioning of the patient for performing an abdominal ultrasound, what is the image interpretation on the screen, and what is the use of the gel in performing an ultrasound. So first of all, we will start from holding the ultrasound probe. This is the curve array transducer, which we have discussed in our previous episode, that it is used for performing an abdominal ultrasound. Its frequency is 3.5 megahertz up to 5 megahertz, and it is used for performing abdominal ultrasounds. Now, for a beginner, I will point out that you will hold the probe just like a pen in your hands, and then kindly move the shirt up. I want to point it out that our subject, we have got an informed consent of performing an ultrasound on a healthy subject for to show you the basic structures, basic abdominal structures. Now, first of all, we have to apply the gel on the ultrasound probe. Why to apply the gel? Because ultrasound waves cannot cross the gas. So to cover the distance between ultrasound probe and the patient's skin, we will apply gel, which will act as a medium for the transmission of the ultrasound waves. To apply the gel, kindly keep the tip of the bottle away from the probe so that it should not touch the surface of the probe. Otherwise, it can damage the this delicate surface, and it can cause the production of artifacts on our screen. Now, we will start. I have applied the gel. Now, I will put the probe on the patient's abdomen in a horizontal manner. And after putting it here, I will lift one side of the probe, and I will see that whether the same side is being darkened on the screen. Now you see that I have lifted the right side of the probe on the patient's abdomen, and the screen side, which has got darkened, is the left side. So it means the probe is not in the correct position. I have to rotate it in the opposite direction. So, or I can also say that this is the point. I will keep it on the right side. Some probes have these pointers. If your probe, the probe you are using has this pointer, so you will have to keep the pointer toward your own side. I will put the transducer again on the patient's abdomen, and now I am again going to lift the probe half so that the image, half of my image will become darker, and you see that now the same side of the image on the screen has got black. Okay. And other thing which I have to always remember is that when I am going to move the probe from horizontal position to the vertical position, I will always move it, I will always rotate it in the clockwise direction. Now, when I have moved the probe in the clockwise direction, now on the screen, this side is the cranial end and this side is the caudal end of the patient. When I am keeping the probe horizontally, now this side of the probe is, this end of the probe is the right side, and this end of the probe is the left side. I am again going to point out that we are not supposed to rotate it in the counterclockwise direction, because if I will move it in the counterclockwise direction, the image on the screen will go, I will get a mirror image. So it will be difficult for me to interpret the image properly. So I will always move the probe in the clockwise direction and never in the counterclockwise direction. Now, look here, when I am keeping my probe in the horizontal direction. This is the side on the image from where the sound waves are entering the patient's body, and these are crossing the body and are crossing deep, going deep and are getting attenuated. So this side of the image depicts the part of the body which is nearest to my probe, and this part of the image tells me about the deeper structures. I have to put my put my probe horizontally in the midline. First of all, we are going to start the abdominal ultrasound. So I will put my probe horizontally in the midline in the epigastric region. When I will put my probe here and I will tilt it a bit upward in the cranial direction, I will be getting a horizontal image of the liver. This is the liver. This is the liver. This is the left lobe of the liver, and this is the right lobe of the liver. Now this was the basic interpretation, and I think so for today's episode it is enough. So for now we will keep our episode here, and in the next episode we will see that how we will image the liver, and starting from the very basics of the liver we will see all the parts of the liver, and we will discuss the Connaught system for the anatomy of the liver. Till then, thank you for watching. See you in the next episode tomorrow or day after tomorrow. Please do subscribe our channel. Stay tuned for improving your skills. Thank you so much.